My name's Gail Murphy. For you in Western New York Law Center who don't know me, I'm the pro bono coordinator at Volunteer Lawyers Project. We are really excited that a conversation that started over a couple drinks kind of blossomed into this. We find working with our clients, like Bob said, sometimes we as attorneys and support staff are really challenged with dealing with clients who tend to present with new and different kind of behaviors each and every day. So without further ado, what I'd like to do is sort of set the tone, set the agenda for the day, and introduce our two speakers. I met Carl Schellehorn today for the very first time, and I apologize for reading, but I do know he's the Director of Community Advocacy for the Mental Health Association of Erie County, as well as for Compare Buffalo. He has an unbelievable pedigree. He's a New York State certified alcoholism and substance abuse counselor. He's worked in both the addictions and the mental health field. He's author of Working on Wellness, A Practical Guide to Mental Health, and he's written and blogged for BP Magazine. He's a certified mental health first aid instructor, which I'm really interested in finding out exactly what that is. He also provides all kinds of seminars on workplace wellness around Western New York. He's on the board of directors for the Mental Health Association of New York State, the Erie County Mental Hygiene Community Services Board, the United Church of Christ Mental Health Network, and the Fourth and Forever Foundation. He graduated from my alma mater, Buffalo State College, which is now known as SUNY Buffalo State, with a bachelor's degree in broadcasting and a master's in student personnel administration. Welcome, Carl. We'd also like to welcome Katie Kestel-Martin, who's an attorney, who's a JD MSW. Welcome. She's an attorney for the Mental Health Association of Erie County and their Legal Services and Advocacy Program. She graduated from SUNY Buffalo with her undergrad studies in psychology, sociology, and philosophy of law. After she did some psychological research at UB, she returned to education to attain her master's in social work and her JD, and she worked alongside of Melinda Saran. So if you know Melinda, you know that she's a really great attorney. She also worked with Lisa Block-Rodwin, and she did some internships with the Mental Hygiene Legal Services in the Family Court. And she's also worked at Western New York Law Center, right, Joe? Yay! So if you haven't worked with her, please stop by later and welcome her. She supervises an expansion of legal services for those with mental health diagnoses and specialty courts. Without further ado, let's welcome our speakers for today.
Thank you, Gail. Thanks, Bob, for inviting us to come in today. Mental health is a very important topic, and that goes without saying. Obviously, we have a packed room here, so there's interest and there's a desire to learn more, and Katie and I certainly appreciate that. We work in this business, so to speak, every day, and we have interactions with people who are dealing with any different types of mental health issues or challenges. So we know firsthand, what people experience, and we also know that for yourselves who work with a variety of constituents, that you see issues as well. So what we'll be doing today, I'm going to be providing information, general information around mental health. Katie's going to follow up with information pertaining specifically to more legal matters. So I'll just kind of get things started. Like Gail mentioned, I have a background in mental health. I've worked in addictions for a number of years. And it's been interesting. I've learned a lot through that time about interacting with others, about that connection with others. And I found that from time to time, I really get the feeling that many people don't really, as I say, get it, so to speak, when you look at people in the community, when we look at mental illness. So I'm going to kind of cover some of the aspects of mental health and mental illness that you may or may not be aware of, and maybe try to give you some information that you might find useful. So we do know that 1 out of 5 people lives with a diagnosable mental illness, and that's a pretty remarkable number when you consider it's 20% basically of our population. Now, what are some of the words that might come to mind? Anybody can just feel free to shout out. What are some of the words that might come to mind when you think of mental illness?
Stigma.
Stigma.
Jail.
Jail.
Crazy.
Crazy.
Functional.
Functional.
Difficult.
Difficult.
Homelessness.
Homelessness. So some of these words are maybe more accurate. Some of them may be more stigmatizing, like crazy. Yeah, we heard that term. And when you talk to the general person on the street, they have a lot of misconceptions. Like I said, there may be a lot of myths associated with mental illness. I gave that statistic of 1 in 5 people. I'm actually one of those 1 in 5 people myself. I live with bipolar disorder. I had my first episode at the age of 18 when I was a student in college in Michigan. I was, abusing drugs and alcohol at that time. I had a lot of stressors at school, and it was just a perfect storm of circumstances where basically I found myself catatonic in my dormitory room. And from there, that was a long time ago. That was actually in 1981. My parents came and brought me back to Buffalo, and I started my journey of recovery over the next many years to kind of get back on track and into a lifestyle that be more conducive and more productive. I did get involved with the 12-step program in 1988, where I've been involved with ever since. So I've kind of had this positive trajectory, so to speak, in my life of recovery. But then eventually I got to a point where I wanted to give back, which is a very natural, I guess you could say, response for many people who are in recovery in one form or another, where I wanted to help others. And that was sort of the impetus to me wanting to go back to school. Along with the information about me going to Buffalo State, I did attend Erie Community College, where I did my coursework to become an addictions counselor. So I got that background there, which allowed me to be trained and educated. And I began my career working at Buffalo General Hospital in 1992. I worked in the addictions program there, and it was interesting there because when I got started, I learned a lot about addiction, and I learned a lot about mental health. And at that time, interestingly enough, the mental health world and the substance world, didn't meet. And so if a person had a mental health problem, and they had what we call a co-occurring disorder, which is basically another issue which might be along the lines of having a mental health issue at the same time as a substance issue, they would oftentimes have to seek treatment in separate places. In fact, it still does happen somewhat now. But there's more focus these days providing what we call integrated treatment, which is where people receive both forms of treatment in the same manner or the same environment. So that is a big push nowadays. So we are looking to do that more and more in the community and providing that type of treatment for people. What do you think is actually the most common mental health diagnosis that we know of? What is
Depression.
depression?
Anxiety.
Anxiety? It actually is anxiety. Depression is number 2. Approximately 19% of people live with anxiety disorders, and that could be any number of different things. We have everything from specific phobias, which might be, like me, fear of heights, or people might have fear of dogs or insects. That's what we call a specific phobia. Or there might be a social phobia, where someone might be uncomfortable in social situations. There's agoraphobia, which is where a person might be afraid of going outside. So there are different types of anxiety disorders. Obviously, OCD is something you probably are aware of, obsessive compulsive disorder, where a person may go through ritualistic behaviors, cleaning, keeping things organized. If anybody remembers the TV show Monk that was on years ago, the lead character was a detective who had OCD. So anxiety is certainly something that's prevalent in our society, but we know that whether it be anxiety disorder, major depressive disorder, bipolar disorder, substance disorder, these types of disorders can be anywhere from mild to severe. So in the same respect, we know that mental health is on a continuum. So it goes from the area of being, aspect of being unwell to well, and everybody kind of falls somewhere in that spectrum. We all fall somewhere in that spectrum on any given day. You may have some days where things are a little more rocky. You might be a little more unwell. You might have a great day. That might be more well. But we all fall somewhere on that spectrum. So you find individuals who are living with more severe mental illnesses are more on that spectrum of being unwell. And that's where you might see some of the signs, more obvious signs, like I have listed here, some of the signs where there might be agitation or blunted affect, where a person might not be able to demonstrate any specific emotion. Not meaning they don't feel anything or they're not processing, but the way that they relate to others when they speak, it's very, like I said, flat, seemingly unresponsive or non-feeling type of emotion that they're expressing. So when you think about it, there are a lot of people who have these disorders that essentially struggle in many ways and have difficulty interacting with others. And so it's through these interactions with others that many times people get this, I guess you could say, misconception that everyone who has a mental illness falls into these same categories. The reality is that only about 0.5% roughly of people in our society in the U.S. have schizophrenia or live with schizophrenia. It's a pretty small number. You figure what? I think the U.S. population is what, 350 million or something like that. I think somewhere around there. But so a very small percentage of people live with schizophrenia. Almost say 2.5 or 2.8% of people live with bipolar disorder. So once again, a smaller number than what is commonly believed for severe illnesses. So a lot of that is perpetuated through the media, through stigma, like that term was used, stigma. You know, a lot of stigma that we experience, that we hear about, is basically perpetuated through the media. It's a lot of the myths that are associated with it. There's a lot of fear associated with stigma because people don't understand. They don't know. They buy into what they see on TV. You know, we hear about, you know, these tragedies that occur, you know, much too often, where an individual or individuals might go on a rampage and kill a number of people. That is oftentimes seen as, you know, unfortunately, how people are identified that have mental illness. The reality is that people living with mental illness are 12 times more likely to be a victim of a crime than a perpetrator. So that's another fact. And you see some of the figures there for individuals in our criminal justice system. You know, criminal justice system, you know, as we know it for felons, is they're becoming the new mental health institutions, our jails and prisons. And that's something that's very concerning, because the reality is when a person goes to jail, they're oftentimes not getting the proper treatment. So when you think about it, for someone, and it may not be someone who you may have interactions with. Of course, I know conversations with Katie, your group pretty much deals more so with civil cases, but you know, there are times when you might encounter someone that might have a background, a felony background, and they may have been incarcerated one time or another. So in that experience, they may or may not have had that proper treatment. We do know that without proper treatment, people are more likely to relapse and have another episode or an event. So one of the things we try to do is provide early intervention. And we do know that early intervention is one of the keys to recovery. In other words, the earlier the intervention, the better the outcome, typically, when we look at someone who's having a mental health concern. We know that approximately 45% of mental health disorders occur between the ages of 14 and 17. And then 75% occur between the ages of 17 and 24. So by the age of 24, rather. So we know that you know, by the time a person's 24 years old, you know, they will likely have had that diagnosis occur in their lives. So really, when you think about it, there are a lot of people out there who are living with these conditions but aren't getting the proper treatment, like I said. So what can you do? I mean, there are a lot of times when you think about, you know, if you encounter someone that might be having difficulty, how to approach them, how to talk to them. Like was mentioned, you know, what do you do if someone is, you know, encountering difficulties that you might know how to manage? Well, first of all, I think the key is being non-judgmental and empathizing with the person. Recognizing that what they're dealing with, what their struggle is, might be something that may not be being treated. Also might need to get help. So we have resources. We've provided some information on the counter out there on the table about the Mental Health Association, which provides a number of different services for people with mental illness. So there are resources in the community that you can tap into to provide help for someone. We have a program called Mental Health First Aid. Mental Health First Aid is an 8-hour certification program. It's an evidence-based program that provides training around identifying signs and symptoms of mental illness. It identifies ways to respond to someone who's having a mental health crisis. You can learn a 5-step action plan to help someone that might be in need. And through this training, you basically give them the tools, very practical tools, in order how to provide the intervention when someone needs it. So we know that Mental Health First Aid is an early intervention tool that people can utilize. The website actually is mentalhealthfirstaid.org. So it's mentalhealthfirstaid.org. On the website, it gives plenty of information about the training. We offer it through the Mental Health Association, Compeer, and Jewish Family Service. So we do have that program available for anyone who might be interested. We do have trainings that will be coming up in the next several months if you are interested. But the point I'm making here is that, and I think that the point I want to drive home is that no matter who you encounter, and no matter what they might be presenting with, that fear that might exist, that uncomfortability that might exist, oftentimes is based on a lot of the messaging we get through our society. Now, I'm not to say that not going to say that if you're in a situation with a client that might be presenting with issues or signs of mental illness, that you don't protect yourself. I always say in our trainings that you are certainly you must keep yourself safe. So we often talk about in the mental health first aid program about having availability to get to an exit, availability to get out of a room. We talk about de-escalating. How to de-escalate a situation where a person might be agitated, how to talk to them, how to allow them to talk and vent and be able to express their emotions and their feelings in a way that is more constructive. So, for instance, if you have someone that might be in your office, or you might be dealing with that might be in difficulty, recognize the fact that oftentimes it may be an acute episode. In other words, it may be only for that brief period of time. We know that many times, with things like schizophrenia, people have episodes that might be more acute. They may not be chronic in terms of how the episodes occur. So there might be brief periods of time where they may not be, decompensating or not exhibiting symptoms. They may have brief periods of remission. Only about 33% of people living with schizophrenia have a chronic condition where their symptoms are ongoing. Another third of the people may only have one episode in their life. The other third may have, like I said, these intermittent episodes. So, as far as mental health is concerned, there's a lot of issues around it that need to be touched on. But in reality, the idea, like I said, is not to be afraid of it, not to be afraid to approach someone, and to be empathetic. If you look at someone who might have dealt with this issue for a number of years, try to recognize what they're going through. Try to recognize maybe where they're at in their lives, maybe what some of their experiences are. Unfortunately, a lot of people living with mental health concerns have had a difficulty in terms of access to a number of things. Housing, homelessness, like was mentioned, is a big problem for those who might be living with mental illness. We deal with veterans. Of course, veterans are now coming back from overseas with issues around mental illness. And so that's a primary population that deals with mental illness. PTSD is a primary diagnosis for many veterans. 22 veterans die every day by suicide, which is a very startling number. So the reality here is that a lot of people are impacted by mental illness, but we don't talk about it. Oftentimes, because of the stigma that exists in our society, people are afraid to talk about these concerns. People are afraid to talk about these issues. People that have issues around mental illness are afraid to seek treatment. There's a lack of access. They may be afraid because of the stigma that's involved. They don't want to tell someone, they don't want to tell a loved one or a friend or a neighbor or a coworker because they're afraid of what people might say. They don't want to be identified as being, as they say, crazy or unbalanced. And then there's the idea of access in terms of just treatment itself. We know that there's a lack of psychiatrists and providers that are available for people with mental illness. There's a great need for these services. Now in Buffalo, even though we do have a number of providers, I actually provided a brochure that has most of the local mental health providers on it. We do have a number of agencies that work with people with mental illness and addiction. But even so, there is a lack of providers. Now, if you talk about areas outside of a metropolitan area like Buffalo that might be more rural, there's even less of access to treatment. So, these are areas where, once again, there's new advent technologies like telepsychiatry, which are being developed to help people in more rural areas. But, I think what we're looking at here is that because of this lack of access, people aren't getting the help that they need. 10 years is the average amount of time that it takes for a person to seek treatment, for all the reasons I just stated. So, if you have someone that you're working with that you might be dealing with, they may not have that access that they might need. So, if you do have someone you're working with that might need help, certainly point them to the Mental Health Association. One department that works within the MHA is called Information Referral. So if you call our number, which is on the one sheet that says what we do, it's 886-142-1242, that's our main number. If you call that number, you'll speak to one of our information referral specialists. These are individuals who have a lived experience with mental illness. Not only that, but they have a wealth of information about mental health resources in our area. They're able to point a person to get the help that they need. We do it in a very unbiased way. We are not directly attached, or we not directly endorse any one program. So when someone calls us, we try to direct them to the resources that they need and that meet their needs best. So if someone calls us, we're able to point them in that direction, whether it be a support group, a treatment provider, or any other type of support they need. This information is also available on our website at eriemha.org. So on that website, there's lists of support groups as well as treatment providers, as well as other resources where people can get help. Crisis Services also, let me mention too, is an incredibly valuable resource in our area. Crisis Services has a mobile team that will go out and meet with individuals that might be in crisis. They're able to do welfare checks. They're able to check in with people that essentially might be at risk of suicide. So all these resources are available in our community, but people oftentimes don't know about them, which is another reason why people don't get the help they need. So one thing you're able to do is, if you do have a client you're working with that might present with some of these issues, give them this information. Feel free to let them know that there is help available. And also, I think another thing I want to drive the point home is to be able to instill hope, and I have that on the sheet there. When I first became ill, when I struggled for a number of years with my own illness, and it wasn't until I entered my first Narcotics Anonymous meeting, in 1988, that I had hope. And I remember walking to that meeting, and a woman stood there, and I remember exactly what she looked like. She was, for lack of a better term, a biker chick. She had a leather jacket on, she had these tassels, and I remember her name, her face. But she stood up there, and she shared that she had 30 days clean. And I sat there, and I was just astounded. I said, how can anybody do that? How can anybody achieve that in their life? I just couldn't conceive it. But when I walked away from that meeting, I was instilled with hope. And it gave me the belief that, maybe I could do this. Maybe I could, get 30 days. Now, I never could imagine that I would have multiple years or even where I'm at today, but just that idea of giving someone hope that it is possible to recover. So, mind you, you're not meant to be a clinician, you're not, a therapist, you're not Dr. Phil, but you can say to someone, what, there are resources, there are places you can go. There is help available if you need it, and point them in that direction. I can't express enough how much the Mental Health Association has helped thousands, literally thousands of people every year that are in need of help through our various programs. Another one of our programs that's on our sheet is Child and Family Support. We have representatives, peer advocates, that work in the emergency rooms at Buffalo Psychiatric Center, Bry-Lynn, as well as ECMC. And so we have people that are there, peer advocates, as well as family advocates, that have lived experience with either themselves or loved ones that live with a mental illness. So these folks are there to help people navigate the system. If anyone here has ever had an experience with a loved one or someone they know going through one of these emergency rooms, it can be a nightmare if you don't know what to do, if you don't know how to help someone. So our peer advocates are there to help them. And so the reality here is that for those who are encountering these challenges, we have people who can help. So those are a couple of programs that we have identified that are able to meet people where they're at in terms of their needs. There are also other mental health support groups that you can find on our website as well. So basically, there's a number of resources that you can have right at your fingertips. Just go online to our website. You can access this information easily. If you have questions about the programs, you can feel free to contact me through the MHA, the numbers there, or even at Compeer. I work out of both offices. I did leave my cards on the table, but feel free to reach out. We're here to help. We're here to answer questions.
I have an education in psychology, sociology, and I also worked in the psychological field, in psychological research for about 4 years, really focusing on the tendency of children and adolescents to be persuaded by family, neighbors, and relatives to start alcohol or substance abuse, and the tendency for them to prolong that from what age to what age. It's actually still going on. It's a pretty terrific study.